this intervention. We're going to do a CT. The CT was carried out after the sonographic visualization, and we see that there is an avascular finding, and you see it in the arterial phase. It's been marked with a red arrow. The interpreter is sorry, this seems to be a technical glitch. In the portal venous phase, in the CT, we see a certain washout phenomenon, but it seems to be limited to that capsule, and the image correlates very well with the ultrasound image, and we believe that this is HCC. In the lower image, you see the coronary view of the liver, and you see that we have a nodular surface because of the long-term cirrhosis, and in angiography we have a reconstruction of the vascularization, and you see that the right hepatic artery is pointing towards the liver, and those small white spots are stones in the gallbladder, and above we see the left hepatic artery. There seems to be a collateral towards the left vascular area, towards the perfusion territory. Your interpreter is very sorry, but the sound keeps cutting out. I'll try to interpret as much as possible, and now the chair has said that unfortunately we cannot hear him, the audience can't hear him either, so there are dropouts. Don't move around, please. No, we can't hear him at all. It's even worse, you have to move. And now we can hear you. You have to move. My microphone is on the left side. Or you can just take off your Halloween mask. Yes, but if I do that, then there will be discussions concerning hygiene in angiography. Is it better like this? Yes, okay, then I'll try not to move anymore. We're going to do a transarterial chemoembolization, and the target vessel is the right hepatic artery, and we'll approach it from the superior mesenteric artery. And we are going to use a 4 French system as a port. Maybe I can show it to you. And the catheter will be introduced in the vascular system of the patient. The catheter is in the aorta above the celiac trunk. Can we just get a close-up? That's the catheter, and the sound's gone. Your interpreter is very sorry. So the image is without any color, he seems to be saying, and I can control the catheter in order to get into the superior mesenteric artery or the celiac trunk. I'm going to do that under X-ray guidance. Can you show us the X-ray? Control, please show us the X-ray. There it is. I think you can see the catheter at the height of the lumbar spine, and it's the lumbar vertebra number 1. Please hold your breath for a moment. And we can go through the images one by one. We've just captured a series. Here you see that the anatomy is quite interesting. I'm moving the catheter close to the celiac trunk, and I'm in a very strong side vessel. It's the inferior phrenic artery. And I have to circumvent it somehow because that's not my target. Let's have another look at the image. Hold your breath. Once again, sorry. we seem to have technical problems with the sound. It's very difficult to hear the surgeon. Sally Trunky seems to be saying. You see the common hepatic artery and the gastroduodenal artery, and also the left hepatic artery, and at the top you see the branches of the left liver lobe, and then you see the vessels going into the right hepatic artery. I have a catheter now, which I can introduce into the guiding catheter. There is a micro wire. I hope you can see it. I'm going to bend it a little. You see that it's bent now, and we introduce it over this full French catheter system. Let's save the reference image, please. Okay, reference image has been saved. Now the angiographic image. We are generating an overlay image now, overlay 53%, and this gives you an idea of the entire vessel system. And you see that the microcatheter is now flowing into the hepatic artery. I hope that talking will actually get it into the liver artery, into the hepatic artery. We're now in the gastroduodenal artery. Now it's gone to the left, fortunately. Now let's have a look. I'm going to magnify now the image in order to check the positioning of the catheter. The catheter has unfortunately started slipping a little, but we are now to the main artery, and I'm trying to get down again through the collateral into the right hepatic artery. Maybe we can just go through the entire series. Okay. I've gone a little too far now. Hold your breath. This is where I have to take a turn, as it were. I've just created another series of images I can use. And I'm going to continue with the micro catheter and the micro wire. The saved images can be used in an overlay and can be superimposed onto the X-ray image. And when the catheter will hopefully move in the right direction. It's a little bit more difficult than I thought, because the vessels are very tortuous and there is a lot of pretension. apply a bit of force. Now we're going to pull out the wire. Unfortunately, you have to create enough space for the application of contrast. Hold your breath. I'm going to take another series of images. And this gives you an idea where there is accumulation of contrast agents. So let's go through the series of pictures we've just taken. So I think we have to go cranially, we have to go caudally, and you see these little vessels. So we will do an embolization with drug-eluting particles. Do you have more time? Yeah, just continue, and we're not going to continue watching, but we will switch back to your operating theatre later. Now we've got Eppendorf and then Bamberg, and then we will switch back to you. Thank you very much. And we're going to ask Dr.